Robo Medicine, Alexander Fernandez, Life News Today reporter. The story examines how medical decision-making is increasingly shaped by automated insurance systems rather than by physicians' clinical judgment. Doctors prescribe medications based on an individual patient's medical history, risk factors, and treatment response. However, for many patients, those decisions now collide with insurance coverage systems that rely on automated rules set by insurers and pharmacy benefit managers. These systems use tools such as prior authorization, step therapy, quantity limits, and preferred drug lists to approve, deny, or redirect prescriptions before a patient reaches the pharmacy counter. A 2026 Health Affairs policy analysis found that more than a third of insurers use or plan to use artificial intelligence for prior authorization, with even higher use in claims processing and utilization management. As a result, prescriptions written by treating physicians can be overridden by software designed to enforce policy criteria rather than evaluate the full clinical context of a patient. Physicians often account for factors such as prior treatment failures, drug interactions, pregnancy risks, age-related concerns, and documented adverse reactions, while automated systems typically rely on limited diagnostic codes and predefined fields. Patient accounts describe delays, denials, and forced medication substitutions despite documented treatment histories. Step therapy requirements frequently trigger prior authorization, delaying care for days or weeks. According to the American Medical Association, nearly 8 in 10 physicians report that prior authorization sometimes or often leads patients to abandon recommended treatment. Data also show that many denials are reversed only after physicians intervene. The AMA reports that more than 80% of prior authorization denials are partially or fully overturned after additional clinical documentation is submitted, suggesting the original decision did not reflect the patient's circumstances. The article concludes that insurers control the rules, automation, and correction timelines governing access to medications. Until those processes are more transparent, patients have limited insight into who ultimately controls prescription decisions, and at what cost to care continuity and trust.